To Adversity to Strength, I'm joined by Dr. Candice O'Neill, a counsellor and psychologist with a doctorate in counselling psychology, specialising in trauma, relational experiences, particularly for adult survivors of childhood sexual abuse. With over a decade of experience across the NHS, private forensic settings and the charity sector, Candice has worked with a wide range of individuals, from those facing everyday challenges to those navigating complex and enduring psychological difficulties, including PTSD. Her work is grounded in compassion, trust, and transparency, creating a safe, confidential space where people can explore their experiences and rebuild a sense of agency in their lives, relationships, and identity. Drawing on approaches such as existential therapy and acceptance and commitment therapy, Candice focuses on helping people reconnect with meaning, autonomy, and growth. She's also contributed her expertise to UK media and national campaigns advocating for the emotional well-being of vulnerable groups. Also, Candice has been through her own trauma herself. Candice, thank you so much for coming on the podcast today.
Thank you so much for having me. It's lovely to be here.
Pleased to finally get you on. It's been worth the wait. Take us back to the beginning. Where did your journey start? Because it's been an eventful one.
Yeah, absolutely. I think overall, I would summarize my childhood as, a really idyllic one. I felt loved. I had safety in my relationship with my mum. I was an only child, but I did have an absent father. Um, there's probably a lot to go into there, so I won't go too much into it. And then my mum was obviously under financial constraints because she was a single mum. She met a gentleman who unfortunately subjected me to some traumatic experiences. And it was all sort of wrapped up in, I will save you, in terms of my mum, and I will rescue you, and I will give your daughter a father figure. And there were years of really, really, really traumatic experiences, coercive behavior, manipulation from his side. And I think I really do believe I've healed from that. But I think part of my healing has been to help other people who've been through trauma. So I've obviously had my own healing and integration process, but I've really channeled lots of my emotional energy into creating a safe space for people who've been through their own traumas. I'm passionate about it. After being a mum, that's my main driver. That's my purpose, is to work with survivors of childhood sexual abuse, adult survivors, and childhood neglect, with the belief that you can really live a full life. You have full potential if you integrate it properly, and it's become part of your unfolding story is how I would wrap it up. Summarize it for you. It's obviously much deeper work, as you know, Lee, really meaningful work, and it's grounded in the relationship. So it's long-term work. I work with people on a long-term basis and lots of stabilization. And hopefully the therapeutic relationship mirrors relationships they can have in the real world. But I did my doctoral thesis on the longer term impact of relationships for female CSA survivors. And actually, there are still some issues well into adulthood that come up. That primacy of seeking relational safety is huge. There's also major social moderation. So people adapting themselves to fit into spaces as a result of the trauma. I'm obviously just giving you a quick summary of some of the findings, and that the sense of isolation as well is profound. This is something that people experience, and they might have a negative disclosure experience that really does impact on the way they integrate this into later life. It's never lost on me that people are courageous and brave in taking the step to engage with talking therapy, or to participate in studies like mine that really do give us new evidence, new insights, lived experiences into CSA. I think there's quite a lot of sort of negative, this is a manifestation, people are more likely to engage in dysfunctional relationships. People are more likely to engage
Yeah.
in drug abuse. And actually, I think I found, reading lots of that evidence, because I had to in order to write mine, to find the place for mine, that there's almost quite a negative spin on CSA survivors, and it's all they have this manifestation, they are a consequence. Then there is way more that they can offer than just that traumatic experience to the world. They can find meaning and purpose if they integrate. And also, let's look at, the positive adaptations as well as the negative. What are some of their skills? They are some of the most intuitive people. They're so self-aware. And I'm not talking about hypervigilance. I'm talking about they can read a room really well. CSA and trauma survivors I found as well are so motivated, so driven, so they know their purpose often. But as I say, lots of the research will suggest that there's all these negative consequences, and that's all that can come off it. And of course, there are negative consequences, unfortunately, but there are also some really heightened skills, some really astute skills that they learn, deep, deep empathy, deep compassion often as well.
Yeah.
I find with CSA survivors that I work with.
Yeah, I mean, I always sort of joke if you've been through a lot of trauma, you end up becoming a therapist,
Yeah.
and especially through CSA as well. And I find that it's still got something that's got a stigma to it. People don't know how to
Mhm.
deal with it. They don't know how to. They'd rather not engage in a conversation. They don't know what to say. They make assumptions there, and they can make the assumptions which can be right because if somebody's gone through that level of abuse, the effect that it can have on them. And if it's left unresolved, it gets worse over time and it can have such a negative impact on their life. It might not be easy and it might be working on yourself for the rest of your life. But you can improve and manage your trauma there, learn strategies, techniques there, and you can make positive use of it without doubt.
Absolutely. Yeah, I'd agree.
One of the guests I had on, one of the few people that I'm in genuine awe of, was Paul Stewart, the ex Premier League player. And I was so honoured to have him on as a podcast and on the podcast. And he was talking about the childhood abuse that he suffered and the effects that he went through, and which I could relate to my own with through my parents. And for him, because he's a well-known footballer, to come out and share that with the world takes a lot of courage. I
Mm.
admire anyone that does that. As a kid, you see footballers, even as an adult, you don't assume, you don't think of them as a child. You think of them as just a footballer.
Mm.
So when they're coming out saying something completely alien to you and saying, well, this affected me, and how did this happen? Um, to listen to what he's got to say, it's so inspiring there. And to see
Mhm.
what he does now, where he goes around football clubs all over the country to do safeguarding there as well. So, and there's other people doing similar. So for me, that's inspiring that you can turn something that's so awful into something so positive, and the help that somebody like Paul Stewart does could save
Mm.
lives,
Absolutely.
stop them from being ruined.
Absolutely. I think I couldn't agree more. And I think that's one of the most special things that I think comes off the back of something so painful is being able to really, really understand somebody else's pain, to really feel it. And as well as I do, therapy is relational at its best. And it's essentially a human to human interaction. I ground lots of my work in somebody called Ernesto Spinelli, who is again phenomenological about lived experiences. And he says we walk alongside somebody. And I think in essence, it is that. Yes, we have a big knowledge base. We've obviously got personal experiences, but it's creating safety and somewhere stable for someone to take. Someone who's been really courageous. My first emails from inquiries will always say, really well done. I'll always want to commend that step. That first step is so powerful, probably in a way they can't really see because they're full of nerves and anxious energy. But that step, rather than keep this to yourself, share it with somebody. The expression of it is powerful. You take back agency then. It becomes something you've got hold of rather than this is something that I feel lost in. It's showing up when I have a child. It's showing up in new friendship. It's showing up in the way I deal with conflict or things like that. That's obviously hypothetical, but it's something that you can get hold of and you can, gradually work to integrate. And as I say to you, I probably use this quite a lot, but I really believe it. I always feel like people have this unfolding, evolving story across their lifespan. And it's not to downplay CSA. It's painful, it's traumatic, it's distress, despair, as we know, but it can be a chapter of your story. And there can be other chapters that are full of hope and fulfillment and deep love and that sort of things. Obviously, that's just a summary, and there's lots of work there to be done to feel that. But I know from my experience, I can get people to that place where this has happened to me. I don't have such intense emotions, but I accept it's part of my story. But it doesn't hurt me as deeply anymore. I've almost not desensitized. That's probably the wrong word, but the feelings aren't as strong. It's not got such a hold over me now. It's there, it exists, but not in such a powerful way.
One of the things that I do with clients, because I predominantly have clients that have been through child sexual abuse, and what
Mm,
is the scary thing is that that wasn't specifically a choice. It's just happened. I just find the
yeah.
vast majority of my clients had been through that, and now it's kind of mainly what I do. But I think for me, one of the things that I want a client to be able to work on is to realize that what they've been through doesn't define them. It was
Yeah,
just
absolutely. Which mirrors, I guess, what I said, your story. It's just,
yeah.
that's not your whole story. That's part of it. I like that a lot. I think that almost is quite freeing for people, that actually it's not the whole me. I'm this whole person that's an employee, a mum, a granddaughter, a
Yeah.
sister. It's obviously the most unfortunate experience you can go through, but you are and can be so much more. I really like, I'm sure you've heard of Sartre, and he talks about the self as a project. I like that
Yeah.
idea and I use that a lot. You are becoming all the time. It's not to minimize the impact, and we work on the impact in multiple aspects of people's lives and how it shows up interpersonally and in their relationships. But it's you're still becoming, you can still be whoever you want to be. You're still learning, evolving, and growing.
And I mean that's true just through everyday life. As you go through the decades there, and you get to a certain age, and garden centres seem quite appealing.
Yes, I agree.
You know,
I'm 39 and that's me. I'm like, oh, I need
and
to
it's
go to
like
the garden centre.
when you're in your teens and twenties, there's nothing outside of a nightclub. But I think with people that have been through CSA, they feel that that's just their world, and when they start having therapy, they actually realise that there's more to life. That it doesn't have to be every part of their day, and there is good things. And one of the things that I've found is that a lot of the times they struggle to feel that they deserve it.
Mm,
Straight away, we're working on that there as well. And
mm.
when they feel that they can do things that they like and it's okay and there's no consequence or whatever, they can find that quite liberating. And I've found clients come back
Yeah.
to me and say, "Oh, Lee, I've started doing this, I've started doing that." And then they're starting to expand their world and it's moving out, not away from it, it's growing from the trauma. Their world is becoming bigger. Whereas before, their world was just their trauma.
Yeah, absolutely. There's so much to be said for self-compassion, being kind to yourself those days when you do feel massively tripped up by, what happened. I like to promote the idea that give yourself permission to be in a non-linear healing pattern. You'll have a bad day, it will feel overwhelming, but we are trying to move forward. It's okay. This is no disrespect to NHS therapy, but mine is open ended and long term. I've had everybody for more than 6 months, other than a couple of new starters, and a couple of them I've had for years because different life events have come up and the CSA has emerged again. The impact of the CSA, sorry, has emerged again.
Yeah.
Whether it's having a baby or relational conflict, infidelity, things, it's come up. So I think, again, not to bash the NHS, but this permission we're giving to people in providing private psychotherapy for it to be at your pace. It's very gentle. You haven't got to go from A to B. It's your journey. We're here for as long as you need. And yeah, I really value that I'm in a position to be able to offer that. And the relationship is so key. I can't stress that enough. I always say to people, the first sort of 4 to 5 sessions are you feeling safe with me, getting to know me, trusting me, leaning in just even a little bit, and then we build on the self-expression. What does it feel like let's name the feelings. And once we've got a real awareness, then we can look at the different pathways. We look at expanding perspectives, broadening worldview, which you spoke about. They obviously that takes time and there'll be a back and forth, but we allow for that because we're not time limited and we're not system imposing how you feel like you've integrated the CSA. It's your journey. And that's really unfortunate, actually. I find that some people have, I'd actually say probably 92% last time I checked of my referrals have tried a specific modality for CSA that just doesn't feel, and I won't say what it is,
Oh,
just, yeah, but does not
yeah.
do well with, oh God, I'm going to
No.
get
Yeah.
cancelled now.
People's come to me, it doesn't even have to be for that. It could be almost anything else. Oh, yeah.
It's
Um,
not deep enough. It's
uh,
surface level, and people need somewhere to really explore.
I'm all about the root causes, and I'm like,
Yeah.
is like anxiety, stress, low mood, and depression. They're all caused by something. You can have all
Yeah.
the best strategies in the world. If you don't deal with those root causes, it
Yeah.
won't. So where does that come from? Then we can deal with that. But it's so frustrating because you get sometimes clients come to you, probably had this before, and you're their last resort. They've done everything everywhere else. NHS, they've had 6 sessions.
Yeah. Or 8 sessions if they're lucky, but they've waited for 4 months.
Exactly. And the problem you've got is they've waited for months and they've
Mm.
had 6 to 8 sessions and nothing's worked and they're about to give up on therapy.
That's so sad when you think about it. Mm.
Yeah.
So
So so the good thing is when they actually speak to like a specialist there, they know that that person, especially with the rapport, actually understands them. And you can just
mm.
see, especially with like a new client, the relief that somebody actually understands what they're going through. And they kind of know early on that they're doing the right type of therapy because it just feels better and they can feel the results, even if it's slowly but surely.
Yeah, absolutely. And I think we were talking about it early on in the interview, like being human is such a powerful tool as well. I know we're talking about building awareness and self-compassion and conscious choice making ability and things, but I think sometimes the relationship itself can be what somebody needs. It's saying you can trust people, you can go out there and there are people that you can lean on and won't judge you, trustworthy, they're safe. And so I think the relationship is so, so important. And that first 4 to 5 sessions, sometimes extending more, I'm sort of learning who do you usually go to? Who's your source of support? How do you typically manage these challenges when they come up? And all the time reinforcing that actually I'm going to be here next week at the same time. I'm going to be here the week after, unless we've otherwise, there's a holiday or something, but I'm going to be, you'll find me in the same way. You'll sometimes touch my heart and I'll be moved to tears. I was moved to tears this week. And, I did for a second think, oh my God, I've like let myself down. But I thought, no, remember you're
It's
human, it's touched your heart.
it's relate. First, I had is actually CBT through NHS.
Did you?
And, I was the first it was years ago, and, most of what I'd been through, I didn't actually know I'd been through it, and I spoke to the counsellor and, when you get clients that are telling you things that they don't actually even realise what they're saying.
Because that's
Uh,
something that you notice as a CSA therapist. I definitely do. There's often lots of storytelling, times details in order to sometimes protect themselves from the feeling. And that's where the trust comes in because they might tell the story again a bit later. Obviously, not the story of abuse because we're not looking to re traumatize, but there'll be less details and more. And I noticed I felt this and I actually feel this now. I think that's sometimes a bit of a way of when they don't, it's usually in the very, very early stages in order to protect themselves from the fear of the disclosure and fear of how that would be met. They'll storytell around it rather than, and I felt devastated. It'll be, and at 6 o'clock when I went to the shops and then I came back, it's all, do you notice that? It's almost like, not quite sure, session 2, I'm not sure if I can lean into this yet. And I'm going to give you lots of details, but less of what it meant for
yeah.
me.
I mean, with some clients that new clients, I'd like to think that they feel really comfortable with me quite quickly with very, you know,
Good.
assets is I can build rapport quite quickly. It's not forced. It's not your standard. Let's get to know each other. So when you got somebody that feels comfortable, and often you find that they've never had a chance to speak about it, once
Mm,
they start, even in the first few minutes of a session, out comes so many things there as
mm,
well. But I've also had it where I've had clients where they've been with me for a long time. They've been wanting to tell me something for over a year, and it's took
mm.
that long to get to the point where they feel that
Yeah,
they can actually say it. So in
yeah.
that time, they've built up that trust. There's that
Mm.
consistency.
Absolutely. Absolutely that. And I think I get like mostly, as you say, the ones that are really ready to go into the feelings, but I honor the ones that aren't and want to know that this is safe. Like I'd rather they honor their process and where they're at rather than leave the room and think, oh my God, I can't do that again. That's been too much. I'm overwhelmed by sharing it. So I'm fine with the storytelling. I should caveat that. I notice it, I take stock of it, and we look at how do we do an intervention to maybe make that feel safer in time and lean into the real core, the safety, as I say. But I think I had psychotherapy with a clinical psychologist where my mum died. My mum died when my daughter Constance was born. I knew she was going to die from leukemia when I was 37 weeks pregnant. I was told she got 4 months left. So I self-referred to a clinical psychologist who was life changing, and it was for grief therapy, Lee. It wasn't for my experiences, my traumatic experiences, although watching my mum die was traumatic,
Yeah.
actually. But I'd gone for like grief therapy, and actually I remember one day in a session, and I'll never forget this psychologist, doctor, I think he still works in Leicestershire. He was doing interventions, and we were doing the work. And he left me with this page of a book one day, and it was so powerful. So it wasn't necessarily what he said, the interventions, the tools. It was, gosh, he captured my experience in this like page of a book. It felt like he really intuitively understood me there. And I really remember that just that experience made me feel seen, made me feel heard. But yeah, it was funny because I'd gone for grief therapy, but the traumas related to CSA that I'd experienced had come up as I'd had a baby. So my mum died when my daughter was 4 months old. And yeah, it was huge, 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 a hugely traumatic experience. But I think a lot of what I had maybe put to one side emerged. This was 12 years ago. My oldest daughter's 12 now. And the experience with Dr. Daniel made me think about doing my doctorate in psychology. I just thought you have the capacity to be life changing. It's not necessarily your skills, it's what you offer to me in that room, in the interaction, in the safety you create, in allowing me to share my stories. Yeah, I think definitely, can be really interventional, and we lean on lots of philosophical knowledge. Our course, our training is very philosophical, but actually I think the lived experience and always sort of in conversation with some of my peers, I'll say, it's really worth people doing extended training on CSA and the manifestations in adulthood, because if it comes up as a secondary problem that you wasn't on
Yeah.
the initial inquiry, you need to meet that experience with the right approach. It's got to be really considered, natural, but considered. And it's so key that you are aware of yourself and you're in that dynamic with somebody. Really important. So something I'm thinking a lot about is how do people counselors or therapists or psychologists, whatever, who get a referral that's anxiety or depression, how do they then deal with a secondary challenge in therapy of a CSA experience if that's not something they're familiar with? I think we all really need to be trained in a better way to deal with that.
Because for people that's been through CSA, it's a minefield. It's a minefield
Mm.
for them. It's a minefield for their family, their partners, their kids. And then so for a therapist to be able to help them, for me, they've got to have a good knowledge. I've got it from personal experience. I've done courses on it. I've got a bookcase full of books on the subject there you know, always be expanding my knowledge. There's always things in there that I don't know
It's
as
a
well.
commitment, isn't it, to always giving the best level of care, always being able to, deal with whatever comes up in that room in the most evidence-based way you can.
I've read books on whether it's like just therapy, psychology, or whatever, and a lot of it I kind of already know. And I was told this at university, that you could be there with a client and you come out with some amazing therapy speech there about like TA or, psychodynamics, whatever it might be. And they will never ever remember anything you've told them
Mm,
about that. You do like some throwaway comment that might be with them for
mm,
life. And that has been so true. So there's been
mm.
certain times with clients where I've said something and they come back, oh, I was thinking about all weekly what you said to me and I'm never going to forget that. And I'm like, what did I say? And I'm like, oh, I
Yeah.
can't remember saying that. With a lot of it was kind of like I learned it in one of the books, and I've had many clients that have come to me and I've used it and it's really worked. Is when they're saying they've got this negative belief system and they're reinforcing the negative beliefs that was forced on them, whether it's verbal or physical or
Mm,
whatever. And I've said to them, don't be your own abuser. And I
mm,
kind of said it in almost like a throwaway comment, as in, yeah, and it stuck with this client. And they come back and they said, I can't stop thinking about that. Why would I want to carry on doing what they can't do to me anymore? And so I've used that many times, and it's had such a positive effect there. So, it's always worth, whether it's, doing another course or reading, even if you know it, because there's always going to be something that comes up.
Oh, yeah,
Bit like
of course.
journaling. You could write page and page of complete rubbish, and then there's something in there that's amazing. Right.
I found that when I was writing my thesis, in order to 76,000 words is huge. My doctoral thesis on CSA later in life, the manifestations in adulthood. And I was reading all of these studies, and so much of the research is really historic. There's actually not much from the present day that really looks at using phenomenology, lived experience, somebody's story. They might look at someone's diagnosis, and I'm very anti pathology, by the way. That's probably something to include. I don't like to put labels on people. I think
Yeah.
you're a whole person, you're more than a label to meet a system objective or box ticking. So there was loads of historic research, as I said to you before the interview, about the negative manifestations. Actually, nobody was really asking, what's it like for you? Like how does this impact on your life? What are the feelings that come up? And that's the most powerful story you can hear, rather than
Yes.
a report or, a tick box diagnosis or like an algorithm. I get quite frustrated with the way we try and fit a survivor's painful story into 3 words or a DSM diagnosis. It's so much more than that for them. And I think, yeah, it's like you were saying, it's really lovely. Someone said to me a couple of weeks ago, my husband really wants to come and meet you. He wants to give you a hug. He wants to thank you. And like those things are so lovely. That's less lovely actually though than when someone says to me, and Candice, I know now I can choose. I don't have to do that. I don't have to tolerate that. And I'm really noticing the pattern, like that's probably more powerful. That comes from them rather than somebody else. So I take those as benchmarks of healing. I can choose now. I know I don't need to be this person that does as I'm told or
Yeah.
performs to other people. I can live my own story. Or yeah, and I noticed as a really powerful one. I was writing about this the other day. Is that's a huge sign of deep reflection. You're engaged with the therapy, you're using it efficiently, you're going away between sessions and seeing your patterns. So, and I notice is a really big benchmark of somebody being able to like really want to move beyond the trauma or really integrate it. I'm looking at myself really deeply, not in judgment, with self-compassion, of course, but I'm seeing eyes wide open the way I've lived my life, and perhaps I don't like it, and maybe I can make some healthy adaptations. Yeah, it's really meaningful work. It's such a privilege and an honor. I'm sure you feel that as well. Like it's my baby after my babies. Like my baby is some mummy first, but CSA survivors being my specialism is like my absolute passion. And yeah, what an honor.
It for me, it is, because if I can change somebody's life,
Mm.
for the positive, then I will. I've done something right. For me, my sort of short version is, well, Lee, why'd you become a therapist? The short version I give is that I wanted to be there for other people when nobody was there for me, and that has proved to be the case.
Yeah.
So many clients, Lee, you're the only person I can come to. and to be able to help them, and feel that they're supported there and help them overcome the things that they might have done there. It gives me a level of fulfillment.
Yeah.
And for me, with like having, you know, terrible parents that told me that I was big, stupid, you're never going to do anything, you're this, and this. So for me to be able to do the complete opposite of that, one, speak out on the things that they were desperate to silence me on, help other
Mm.
survivors that's been through the same or similar as myself, and to go on and achieve as much for myself personally as possible gives me a
Yeah,
lot of fulfillment. But the
absolutely.
biggest one for me is when you see a change in somebody that has come for therapy and they are struggling, they've had a lifetime of pain, and to
Mm.
see them get to a point in their journey, whether that's just carrying on therapy or they finish therapy for the time being, and see their lives have changed.
Yeah.
That one is a personal victory for me in my past, and two, I'm grateful that they've trusted me with their help and they've the changes in their life which has made a positive effect for them.
Yeah, I'd agree, and I think that that's so powerful. Like I'm sure I spoke to you about this before the interview, but when I disclosed my experiences, my mum was there, and my mum was just, I wouldn't change my mum for the world. I'm so fortunate. She had no idea. She just trusted somebody, and that was based on her beautiful qualities, but she had no idea about my experiences. My auntie was there at the time, and my auntie actually hit me and was convinced that I'd engaged in something at 12, 13 that I hadn't. My mum's response was appropriate. She rang the police and did all the things you're supposed to do and was really compassionate and loving. And I can't fault her for that. But, research evidence shows that that disclosure experience is so key. Like the way somebody responds to you. And unfortunately, mine was horrible from my auntie and her hitting me, but I remember this every time somebody discloses to me that you can have a significant impact. And I always like to think my two big things that I really try and facilitate are agency and autonomy over experience. But when you see somebody well into the therapy journey, a year into it, 9 months into it, and they become their own advocate, that's like the most beautiful
Yeah.
thing. So it's almost like you prompt all of these mechanisms of self-compassion, self-awareness, choice making. Eventually, you see these shifts happen, don't you? And then, like, they're making these decisions for themselves. It's like eyes wide open, and it's the most beautiful things. And then we recognize that actually part of that will be, big part will be their work, their belief in themselves, their courage, their transparency, their commitment to the process, all of those things. But actually, the way we responded to them, the way we continue to respond to them every week, we show up, this is your safe place. This is, you could say whatever you want. This might feel confusing. You could come in angry today about the experience and you could swear, not towards me, I've never had that, but swear. You just describe how you feel about that family member, and that's okay. If you want to walk around, that's okay. I'm just really pleased I say to my peers, like, people have to be courageously vulnerable, I think, to go to therapy. So they have to find the courage to be a bit vulnerable to a process.
It takes a lot, but there's another side of it. You probably found, we would have found it yourself, is where you got a client that's talking and you
Mhm.
might ask them a question. Again, it's like almost like a throwaway question. It's never like often a big heavy question. It's like just a real brief question, and it's kind of caught them unexpected. Suddenly, all their emotions have come to the surface,
Yeah.
and suddenly they're letting out all of this pain
Mm.
and all of these memories that are coming back there for the first time. And
Mm.
sometimes when that happens, they're almost unstoppable. And for the
Mm.
first time ever, they're feeling like a weight's being lifted, even though often they're in tears and their emotions are high. And then they actually want to start talking about it.
Mm.
This is the first time I've got somebody that's listened to me. I trust this
Yeah.
person, and out it comes. And almost they can't stop. I'm like,
Yeah.
just keep on going. They're like, Leash, I'll take a breath. No, keep going, keep going.
Yeah, those are the sessions that, you stay longer. You want them to feel unsure if your modality sort of promotes this, but the existential one definitely does this metaphorical holding. we heavily promote that idea that you're being held in therapy. We're not obviously holding them, but they're being held by the process and the relationship. So yeah, stay longer if you want to share something and it feels inappropriate to say, I'm really sorry, time's up, I'll let them carry on.
I've had that many times,
Mm,
and I explain to clients what a doorknob moment is. Like, save that for next week. Trust me on that. But if they're in full flow,
yeah,
something that's been coming for a long time, and it's their time, I don't want to say, "Oh, we're at the end, save it for next week," because that.
yeah, absolutely.
Right.
Absolutely that. It's the
If I've got
courage.
if I've got the time, they're like, "Oh, leave it at the end. Keep going, keep going."
Yeah. I had a lovely lady last week, new starter, to me. No, we call Ash, she's 3 sessions in now. And sort of spoken to her about prices as you do typically when you're onboarding somebody. But she was telling me she's doing exactly this. She's telling a story. And I said, it's okay, carry on. We'll keep going a bit longer. Like, it's fine. And she'd actually counted how much longer and worked out how much I would have been. And when she asked my bank details after the first session, she said, I'm going to pay you this much because the extra time. And I was like, oh my gosh, no need. Like, please don't. Like, I just want you to come back knowing that this is the place where you can say whatever you need to say. You can share whichever feelings feel appropriate. It's stabilizing at the moment. It's safety, as I keep saying, but this hopefully will be that place for you every week. And then in time, you'll learn that you'll have relationships in the real world that are safe for you to do the same thing. But she actually worked out by the 5 minutes how much extra and said, I'm going to send you this much. I said, oh my goodness, no, please. Like,
Yeah,
just walk through that door again next week, knowing that you've made a commitment to yourself and your healing and your integration, your growth and your process and your story. This is something that you'll be able to talk about in years' time and say, I'm really glad I went to therapy. I did that. I got myself there. I walked through the door. I sat in some moments that felt uncomfortable, but I got through them for the greater good. So yeah, it's
yeah. It's really, it makes all of the difference when you've got a client that has got a therapist that is genuinely there for them. They're not
mm,
going through the motions, tick box exercise that they,
yeah,
and they're invested in that person. Might as well be the only client in the world. Finish, I've got a client waiting. So we've got time. They know
mm,
it's limited time, so they're going to cut it short. Right? Okay, there's some time. We can always carry this on next week, but they've
yeah.
not cut short in full flow because how long has that taken them to build
To
up
tell
the
that,
strength
yeah,
to tell that?
absolutely,
Yeah,
absolutely. And sometimes it means you'll run over. On a Wednesday, for example, my clinic is full now for a Wednesday and it's back to back. I don't have a break, but the next person can wait, and then the next person can wait, and then the next person can wait. It's okay. I'm not disrespecting them, and I wouldn't do it every single time. But if I sense, and it is a lot of sensing, that this was really courageous, really brave of you, I'm going to honor that and I'm going to give you the extra time and that we will
yeah.
just roll, roll on.
There's been many times I've had to send an email out saying I'm running late, or
Yeah.
I've had to reschedule a podcast because I've run over because I've got a short window between clients. If I'm running behind one, then I could
Yeah.
end up running behind the others there as well. I think one of the things that you do that is really important that you said about is about how survivors are in the here and now,
Mm,
because what really stands out for me is that a lot of people are focused on what happened in the past, in the actual childhood there, and it's all terrible, and there's so much there to focus on. But it's
mm,
often about how people are feeling here and now, and how what went on
absolutely.
decades earlier affects
Yeah.
them now. And I know from my own experiences that that how I still feel affected. You wake up on like a Monday morning and you've just got this like this just like a void inside
Yeah.
of you, and it's like, what's the meaning of life and how am I going to get through the day? I've got clients and I
Mm,
know where that comes from. And
mm,
when I spoke to Paul Stewart on the podcast, he said it so well. He said it wasn't what wasn't the worst wasn't going through the actual abuse at the time as a child. It's the effects that he had on him as an adult,
yeah.
and it just kept
Yeah.
getting worse. And that is so true. And I'm surprised, but it gets missed.
Yeah, no, and that's what came up for me when I had my child is, my goodness, so she might have male teeth. I obviously don't think this now, she might have male teachers, and she might go to an after school club, a football club. Like, how can I manage all the risks when my mum didn't know there were the risks she trusted? Like, where is the balance between like protecting and being overprotective and protective? And that's what came up for me. So I completely agree with you. It was, how do I protect this vulnerable person? I have this overwhelming responsibility. So yeah, it was less about grief therapy as such and more, oh, I'm really becoming quite anxious about males in my family. Just at that time, I'm obviously not now, please understand, but it was the heightened emotions of just having given birth and the death and trying to process and make
That's a
sense.
lot. That's a
Yeah,
lot.
but I'm like you. I'm very like the existential approach is very much in the here and now. Like, how is this coming up for you? Rather than take me back. I never want to re-traumatize somebody. So we will never talk about the exact abuse experience. It will always be, soothing parts of you that are coming up in the here and now from then, but we never talk about the actual experience. It's too dangerous, and it feels like the work is to understand and make sense of the emotions associated at that point.
I've had different experiences with clients when it's come to talking about it. I've had clients that just want to be in the here and now and deal with the effects.
Mm,
And they might briefly go over kind of what happened. And then I've had clients that want to go back and they actually want to
mm,
talk it through, because what has often happened is as they're talking it through, and it's happened with myself, my own therapist, as you're talking it through, the memories are coming back literally at that moment. I'm
physiological.
mindful, and I say it to a client, I say, I'm mindful. We talk about whatever you want to talk about.
Mm.
It's down to you. Don't talk about what you think I want you to say.
To give them the choice.
Be mindful not to re traumatize yourself,
Yeah.
and only talk about what you're comfortable with. And if you find that you're getting to a point, just stop.
Yeah, and that's a really such a good approach. I love the fact that you're honouring agency. I sometimes think that people feel they should talk about it. There's almost like, well, that's why I'm here. So I always say to them, if that's super important to you, let's think about it and maybe we approach it another week. Because I think sometimes people there still are, and you can have the most lovely relationship, and I'm really proud of the relationships. But sometimes in the early stages, it hasn't happened for years now, but some people might think, oh, well, I should just almost do what I'm told. I should just share everything. And I think maybe then they can find themselves sharing, going out of the therapy room, sharing the raw experience, I mean, and then they're left wide open and left
Yeah.
for a week. And that can almost like completely destabilize them. So I get absolutely get what you're saying. And honestly, obviously, sorry, honor choice making and their ability to choose. That's at the core of the therapy. But I would always sort of be really cautious and maybe ask them to think about that. Let's consider what that might be like for you. And we do it next week or
The things that I've done, I had a client, and she really wanted to talk about what had actually happened,
Mm,
and she was trying for so long, and I was like, just let it go. You're not ready to talk about it. She's like, every time I try and think about it, it goes out of my head. I can't think about it. I was like, and I'm very much into your body talks to
yeah.
you, very much
Mm,
into. So I'm like, right, for me, your body, your brain is telling you you're not ready to talk about it. That it can wait. We've got plenty of other things that we can be working on.
and build the compassion, build the strength, build other skills that will support that disclosure at that time. I think that that's really, I think it almost prepares them. I think it's nice to have the preparedness there rather than them think, oh God, I think I should speak. I should just say everything because I've come to therapy. Of course they want me to. Like, I'll just open the box and
That's it.
Mm,
And like with what I've had with clients is where they've been unable to say what they wanted to, they've been able to do it further down the line after they've had however much more therapy. And it's not
mm,
like, right, I'm ready to go for it now. It's actually the next step in the conversation. So
yeah,
step. So
absolutely.
when it works, wow, as opposed to like, I better get all, no, you don't. You focus on what you want to focus on,
Yeah,
what you are
so
ready to talk
true.
about, nothing else. The rest will take care of itself. Where shall I start? Wherever you want, it will find a way. And they got that reassurance because they're like, oh, do I go back to the beginning? No, just start wherever you want. Whatever
Yeah.
your brain's telling you, we'll go with that and we'll deal with the rest along the way.
Because you're constantly reinforcing that this is your journey, this is your therapy. I'm walking alongside you. I really like that. That's such a lovely way to be. And um, I actually had somebody, the second session, they handed me an envelope of notes, which was almost like I honor my process. I'm not able to share the details, but it's all written down. I really liked that. I had huge respect for that. I'm going to give you an insight. I'm going to give you the information, but I'm going to write it down. This is my way of doing it that feels safe. And we did come back to it in conversation later, but yeah, you just reminded me of being handed the envelope and just thought, actually, yeah, this is a reminder we're doing it your way. We're doing it in the way that's safe for you, and we'll build on that safety.
And that's what makes a difference, because I've had clients come to me that's tried different therapy and therapists, and the therapist has tried to go in the direction that the therapist wanted to go in, and it wasn't
Mm,
right for them there. Whereas for me, being integrative, that makes a big
yeah.
difference. That you
You
see
mix,
flex.
yeah, you see the person in front of you and you draw from lots of knowledge base. I obviously have like my core approach, but I integrate ACT. I've done training in TA, DBT, other things. It's whatever I feel is right for that
Yeah,
person.
exactly. And I'm
Yeah.
so used to half the time I can't even tell you which therapy I've just done.
And it's
Ther-
okay as well, I think, to ask permission. I always say to people sometimes, because I have quite an organic flow. So it starts with, how has the week been? Naturally, the big issues come up, even if they say, oh, yeah, I've been fine. It will always turn
when I,
into.
when I did uni, I went to Chichester Uni, and it was very person centered. And my
Mm,
highest assignment mark I got was why I don't like person centered therapy. And all the teachers were just totally person centered therapy. And
mm,
they're like, why do you not like person centered therapy? I said, because it's like an echo in a room, and you're paraphrasing, and you're assuming that they
mm,
know the answers to everything, whereas they don't. And that's been proven, because the
mm.
vast majority of my clients come to me going, Lee, I don't know the answers. Can you help me find them? Yes, we can. Do that person centered. So that's why a lot of people have the sort of negative experiences. They're not getting what they want there as
Yeah.
well. So I think it's important to do the integrative, but whichever one it is, a lot of the time I have to probably rethink about which one I've just done. Is that just that one? Is that TA?
Even down to like interventions, I'll say to people, like, do you want this organic flow today? Like, or should we go to a tool? People actually are really responding quite well to that, I find. I didn't used to ask people, and not so much with CSA actually, but with other presentations, I might say to them, do you want to do a really overt intervention today? Rather than me do my intervention formulation as I'm speaking to you, do you want to do like something that you can take away and look at in 4 weeks and see how you feel about that? So I always like to give permission if I can. About the person centered, it's funny how we get to know what really aligns with us. And something that I think sometimes trips people up is, one of the things with the existential approach that we do is gentle confrontations. And we're not saying, no, 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 that's not right. Why do you think that? That's nonsense. Not that at all. It's more being curious and exploratory around, how do you get to that viewpoint? And actually, when you almost very gently confront it, it might be an adaptation rather than actually the way they feel authentically. So I sometimes have intro calls and I'll say there are sometimes gentle confrontations. It's not a confrontation of you. We're not in confrontation with each other, in conflict or anything, but I might really want to expand that worldview, that perspective, to allow you to see different ways. Because it might be that you say, I can't do that. I can never do that. Well, actually, let's work on
Yeah.
possibility. Sure, you do similar. It's
I,
probably
I,
a different
yeah,
name.
I do. Probably less academic and professional as your way.
Do you know,
I,
I laugh as much as I laugh with you. I was literally the last couple of weeks, I've cried happy tears for somebody who had the most beautiful news. One of my patients had such wonderful news. And then also there are particular people on my caseload. I adore them all, but there's one and we do laugh regularly, to the point where I was crying last week. She made me laugh so hard. So I want people to know that it's not this stuffy, serious thing all the time.
yeah,
It's
no, it's
laughing.
yeah.
It's
I'm just myself. I'm no different doing an interview.
this is me, and as a therapist,
Yeah,
unfortunately.
whether I've friends in a pub, or I'm just myself.
Mm,
Wherever I go on, whoever I speak to, I'm just me. And sometimes, it's not like a life coaching session and a motivational session, but sometimes you can
mm,
have a level of conversation with a client where they can come out feeling like motivated, and they got a lot of belief and energy from it there. It doesn't have
Mm.
to be doom and gloom or anything.
Yeah,
It's just
absolutely.
whatever goes.
And that's beautiful, isn't it? That we can, bring so much of ourselves. I feel really fortunate for that. As I said to you before the interview, I work with somebody in Birmingham and I'm from the West Midlands. And every time she says Bab, I'll go, oh, because I call my children Babby, even though I live in the little village in Leicestershire. The word Bab, Babby, variations of that is like home for me to hear it. So I always have a moment and she laughs when I go, oh, when she says Babby. And that's being human. I think that's at the essence
Yeah.
what it is.
Yeah, I think it's essential, and it goes with the relationship and the connection. It's so important. So you've done amazing with what you're doing with your practice there. What's the
Yeah.
future looking like for you? What have you got planned for the future?
I definitely want to, well, the God, you've asked a big question. So I wanted to do, there were 9 brave survivors that contributed to my thesis that I submitted last year, the 76,000 words. um, I would like to get an artist to do an artistic interpretation of some of the quotes with their permission, because there's some really powerful quotes in there that would really touch your heart, and really give more scale to the impact of CSA. So I thought like an exhibition would be amazing with their permission. But what else would I like to do? I continue my CPD. It's an ethical obligation, as well as I want to be the best um, advocate for CSA and trauma survivors that I can. So I'll continue to learn. I want to build a practice of associate practitioners that feel as passionately as I do. And maybe that will be full of people who've lived through trauma themselves, like you and I. I hope so. I hope that that really builds on that being human and really being attuned to people's pain. So I'll build a practice and yeah, just keep advocating in any way I can. I think give voices. 1 in 20 children in 2024 were found to have experienced CSA, and that was the NSPC released that data. Yeah, 1 in 20 children have been through CSA experiences. So still really high rates. This is still prevalent, and unfortunately it's shrouded in secrecy and stigma. And we need more people like us to say, no, you're safe to bring this and we can help you integrate it and live that life full of potential and possibility and fulfillment. So yeah, I'd like to do some work with young people. I'd like to do work with young men and schools. I look at the curriculum for sex education and there's a little bit around consent, but really nothing about disclosure of CSA. What do children do? I'd like to think that I could have some say so in maybe some policies around that, because I've worked with a range of people, CSA survivors, from people in their 70s to people who are 18. So I think I've seen the range, as you probably have as well, Lee. I'd really like to share that knowledge. It doesn't feel enough to just know a lot about CSA and its manifestations and how to work with it. I want to action it and create more safe spaces, whether that's school environments, youth clubs. I'd like it to be that young men have more of a space to speak as well.
This is why I decided to speak out, because there's
Mm.
so few guys, people like Andy Woodward, another footballer, David White, Paul Stewart, are speaking out, and there's a few sort of celebs as there, but
Yeah.
it's just not enough for guys. So
Yeah.
that's why I decided, after the Paul Stewart interview, decided to really start speaking out, because for a lot of people would never have assumed that myself would have gone through everything that I went through. And so I think if that can help, then great. But I think
Yeah.
everything that you are doing and are going to do, which is obviously going to be a lot of things, is just
Oh,
brilliant. You've got
thank
so
you.
much passion there.
You too. It's so nice to meet somebody that feels the same level of, it feels like we're their advocate. And I hope to never lose out saying that provide, for CSA survivors. You do a great job. There's other great CSA specialist psychologists, therapists, but we need more of it. And we need people who feel this passionately. It can't just be another patient. It's so much more for that person than that. It's become their whole world often and their whole life story. But it doesn't have to be. It doesn't have to be their life story, and that's where we come into it.
Candice, thank you so much for coming on the podcast.
Thank you for having me. I've loved chatting with you. Really loved chatting with you.
Thank you.
Thank you.